I'm the Executive Director of the Health Foundation. We are a secular organization here in Wilkes County dedicated to the health and well-being of the people who live here. As my friend Nelson mentioned, we are a sponsor of tonight's event, and I do thank you all for being here. When you RSVP'd, you called my assistant, Holly Norman, who acted as the Vanna White, hold on to the mic person. And Holly, thank you for making tonight so special. I'm also here as a member of St. Paul's Episcopal Church in Wilkesboro. I first attended St. Paul's back in 1977. I was visiting my parents and attended on a Christmas Eve service. The small chapel seemed somewhat like what I would think the little manger in Bethlehem might have looked like, and I was instantly charmed. Some of you may remember Frank McKenzie. He was the minister then. He noticed how I talked back then, and he said, "Well, Heather, are you a Yankee or are you a darn Yankee?" Now, you knew him, he didn't say darn. But anyway, I said, "Frank, I don't know that I know the difference." He said, "Well, are you staying?" I think so. I'm also here tonight in a rather unique position. I've been actively involved in the last year in two very separate processes that took place. The first is a community health needs assessment. It was conducted by my friends at Wilkes Regional Medical Center and the Wilkes County Health Department. This study focused on all of the healthcare problems and needs that we face as a community. I'll be telling you a little bit about that tonight. The second was a 2-day workshop for health seekers and healthcare providers. This was conducted by FaithHealthNC to determine what assets exist in Wilkes County to tackle these problems. The process is called Participatory Inquiry into Religious Health Assets, Networks, and Agency. Now, this is not to be confused with that small flesh-eating fish, but I will admit it was very intimidating to be trained in such a sophisticated research model first developed to identify health assets in South Africa. Simply put, though, Piranha looks at what's here and how everyone can work together and come together to solve problems. And I'll be telling you a little bit about that tonight, too. So just so you understand what you're in for, I'm going to be talking about 79 pages of data collected over a year and a half from hundreds of participants that was then cross-referenced with data collection from inpatient records and outpatient hospital records and death certificates, and you name it. If it was under a rock, we turned it over and looked at it. Now, Father John Shields from St. Paul's is here tonight. He says there's a recovery and support group for folks like this who talk too much. He said the first step is to admit you have a problem. The fourth step is to seek forgiveness. I'm hoping that I can do this in a way that I don't have to ask for your forgiveness. I have admitted we've got a lot of ground to cover. Anyway, I'm no preacher, but see me at the next meeting of on and on and on if I go too far. So let's talk health in Wilkes County. First of all, how do you define health? The World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the presence of disease or the absence of disease or infirmity. So as we talk about health tonight, bear that in mind. And that's where we're going to start, with the mind and with mental health. Perhaps you'll be pleased to know that a majority of people in western North Carolina do not report being depressed. That should be small comfort, though. Wilkes County actually ranks 17th out of 100 counties in the rate of suicide. Participants at our Seekers Workshop readily identified stress and depression as two factors negatively affecting their health and well-being. They talked freely about the economic downturn of the past 20 years, failing textile manufacturing, furniture and tobacco industries, the relocation of Lowe's companies, changes in the banking industry, even the closing of the Speedway. Unemployment, which hovers at around 11% here, was named as a major contributor to stress. Times are hard, and circumstances beat people down, affecting their mental and physical health. And so, I ask, do we hear the cries of people who are stressed and depressed, even those who are too proud or too ashamed to admit it? How can people of faith respond to those cries for help? In the community health asset mapping workshops, healthcare providers identified this as a key area in which the faith community could play a huge role due to a link between spiritual and emotional health. The faith community was identified as a place that could provide emotional support, prayer, hope, financial support, and money for emergency medications. And here's an interesting exclamation point. It's where the needs research and the assets research intersect. Respondents to the community health needs assessment indicated that they would seek help for depression and other mental concerns from their ministers and their congregations first. Substance abuse is another mental health issue that came up as a priority in both studies. At one point, Wilkes County had one of the highest rates of accidental poisonings in the country. Translated, those poisoning deaths are caused by overdosing on prescription and non-prescription medications. Sometimes people take leftover medicines that were meant for something else. Sometimes they simply take more medicine than is prescribed, or they take it too soon, too often. Sometimes they just want to escape their problems and they think that they can self-medicate with a pill. Sometimes people get addicted without ever meaning to. Perhaps also tied into substance abuse, because we know we shouldn't drink and drive, motor vehicle injury is a leading cause of death in Wilkes County. That is not the case in the state of North Carolina, but it is true here. And so I ask again, what can the community of faith do? I mentioned that the economic downturn was readily discussed during the asset mapping. It certainly came up in the needs assessment as well. So let's talk poverty. Wilkes County's current unemployment rate, 11%. And respondents reported that a lack of insurance due to unemployment or underemployment, high deductibles on their insurance, and an inability to afford transportation just to get to and from the doctor. Those were all barriers to care. If you have insurance, you probably have a doctor who knows your name and keeps your medical records. When forms come home from school for your children, you can write out the name of the pediatrician. And when you go to the doctor's office, you and your child get sick, you can. You can just go to the doctor's office. But not the poor people in Wilkes County. 35.1% of children are living in poverty here. That is more than 1 in 3 children. And overall, almost 1 in 4 people here live in poverty. Higher than other counties nearby, higher than the state. People in poverty, maybe they don't have a doctor. Maybe they wait until they're really, really sick, and then they go to our emergency department. That is not the same as having a medical home. Now remember, health isn't just the absence of disease. About 1 in 3 children in Wilkes County are what we call food insecure. Now notice I didn't say hungry. The USDA doesn't measure hunger, that sensation in your belly that comes when it's time to eat and we haven't served you dinner yet. Maybe you were hungry when you came here tonight. I hope no one's hungry now. Food insecurity is different from hunger. Food insecurity is when your access to nutritionally adequate foods are limited and your ability to acquire nutritious foods in socially acceptable ways is uncertain. 1 in 3 children in Wilkes County aren't sure where their next meal is coming from and whether it will simply fill up their bellies with empty calories or provide them nutrition that they need to grow up healthy. Half of the children in Wilkes County are at an unhealthy weight, but just like the people who can't or won't tell you they're depressed, these children are not crying and complaining out about their hunger. They are crying out in the studies that show that what they are eating might as well be garbage. When a mother fills her baby's bottle with milk and crushed up crackers, and that happens here more than we would want to know, when she fills her baby's bottle with milk and crushed up crackers instead of formula, she isn't doing it because she doesn't know any better. She's doing it because she doesn't have any better. Our infants and children are being set up for a lifetime of chronic health concerns like heart disease and diabetes if we don't get a handle on this, diseases that are already epidemic among adults. And so I ask you again, can you hear these cries? How does the faith community respond? The person who doesn't have a doctor, you may never hear him complain, but the death rate in Wilkes County for colon and rectal cancer is almost twice as high as that of the state. It's significantly higher for trachea, bronchia, and lung cancer. It's safe to say that all cancers in Wilkes County, those rates are higher than the state. We know that early diagnosis means a better prognosis, but you don't get diagnosed unless you have access to preventive care. And let's face it, if you throw a prescription in the trash because you don't have money to fill it, it really doesn't matter that you went to the doctor's office or the emergency department. These people, we may not hear their cries, but they are dying. They are dying prematurely. Can you hear the call? And how? How does the faith community respond? A recent report shows that perinatal death and neonatal death rates, these are babies and babies, Those rates are going up across the state. And both of those rates for unborn children and newborn children are higher in Wilkes than in the state. Their cries, they're so soft. Do you hear them? Here's some good news. Participants in the Community Health Asset Mapping identified a list of more than 80 entities with an ability to positively impact healthcare here. Wilkes Community College and the Wilkes County School System ranked high for their contributions to employment and education. The college especially was seen as a core institution holding this community together, one that benefits more than just college students. It was identified as playing a key role in community outreach projects like this one, and got high marks for recreational services too. It can be concluded that groups who were identified by multiple participants over the several days we worked play a central role in the life and well-being of the community. Both Wilkes Regional Medical Center and the Wilkes County Health Department are to be commended. They were recognized and were noted for being places of employment, accessibility, and for their tolerance. The nonprofit community at large ranked high in contributing to the support of diversity and tolerance as well. Nonprofits such as CareNet Counseling, Ebenezer Children's Home, and the Health Foundation were also recognized for providing counseling, education, and a forum for advocacy in this community. Nonprofit organizations and churches were both given high rankings in ways they contribute to the community's health due to the psychosocial support that only you can provide. Here's some better news. Participants noted many congregations, but as there are about 300 churches in Wilkes County, this list, it's just a start. A number of organizations were identified as exemplary because of their broad impact on the community. Notice, please, that seekers of healthcare strongly identify churches as a community health asset. If you have not heard the call, read it, see it, hear. Now, I said when I started this talk, I was here tonight in a number of roles. What I speak now is not as my role as a foundation director, a member of any particular religion, or as a member of the asset mapping team. I speak to you now as a fellow person of faith. Goliath in his day was seen as a formidable foe, 6'9", lots of weapons, full body suit of armor. He was intimidating, and grown men shivered in their boots at the thought of doing battle with him. Tonight I've had a chance to share with you some pretty scary statistics about Wilkes County and the state of health. Overall, we're ranked 75th out of 100 counties. So it's a pretty giant and fearsome problem itself. I'm the first to admit to lying awake some nights, tossing, turning, what and when and how to deal with these issues. Where do you start? I get scared. I know that alone, I and any organization in here is inadequate to the task. I get scared because I hear the cries. I've talked to the mom who couldn't get dental care for her child, 14 cavities in a mouth of 15 teeth. I know the girl who threw a prescription for an ear infection in the trash because she didn't know where the money would come from for an antibiotic. And I bought dinner for the guy who fished my daughter's cheeseburger out of a trash can because he didn't have food. Let me tell you a quick story. Farmer Fleming was working in his field one day. He heard a small boy crying. The boy was getting sucked into a bog. He was struggling to get out, and the more he struggled, the more the bog was pulling him in. He was about to be drowned in the mud. He did what I expect most of us would do. He dropped his farming tools, he ran to the boy, he reached out a hand and pulled him from the muck. Now this happened a long time ago. It happened in English countryside. So sail back with me in time and over the ocean and picture that. And picture the next day a nobleman riding up to this poor farmer's home. He rides up in his beautiful suit, and he offers Farmer Fleming a reward for having done what any of us would do. And Farmer Fleming said, "No, thank you." Just then, Farmer Fleming's son ran out. He wanted to see this handsome horse and this handsome rider, and sensing an opportunity, the nobleman said, "Let me make you a deal. I'd like to send your son to school. I want him to have every opportunity my own child will have. Let me send him to school." And he did. He said, "I expect that if your son is anything like you, he will do us quite proud." So it came to be that the humble farmer's son had the same educational opportunities that the nobleman's son did. They were called into different professions, though. The farmer's son became a doctor. You know him as Alexander Fleming. He discovered penicillin. The nobleman's son grew up to be a statesman, Sir Winston Churchill. So sometimes I understand what's at stake. I get scared when I hear those cries. Who knows what's at stake if we fail to hear, if we fail to answer? On those nights, I need to be reminded to answer my fears with my faith. And when I do, I get a good night's sleep. And sometimes I dream of slingshots. Thank you.